Welcome to the Remarkable Dentist Podcast with me, Fred Joyal, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Welcome to the Remarkable Dentist Podcast. I'm Fred Joyal, and I am here today with Dr. Amanda Canto, who is out of Houston, Texas. And she has a remarkable practice, of course. And we're going to hear all about it, all the twists and turns and successes and failures. But it's really an amazing practice. And she's had a really interesting career. So without any further delay, Amanda, welcome to the podcast.
Thank you, Fred. And I do feel very honored that you've invited me. And I thank you for the opportunity. Thanks.
Now, we met a long time ago at a Fortune event. I think it was at the Navy Pier in Chicago.
Right.
And you were going through some big changes in your practice. But before I get into that, how long have you been in dentistry? Because nobody can tell your age by looking at you. You're somewhere like underage, should be carded, or you've been around a little while. But
you're a bit too kind. You're a bit too kind. But yeah, I've actually been practicing for 32 years.
Wow.
So,
okay.
Yeah. I did get ahead a little bit in school. So I finished dental school at 24. So it puts me a little bit younger than the 32-year, careers usually, but not that much. I've been around for a while, so I'm not that young anymore.
No, well, doing great, innovative dentistry will keep you young, I think.
I think that's very true.
So what got you into dentistry? How did you pick this profession?
So my parents are both immigrants. My mother from Lima, Peru, my daddy from Panama. And, I don't know what it is about them, immigrant parents, but they have this thing that, you got to be a doctor. So
somebody's got to be a doctor.
Yeah. So my dad said I could be a doctor. Or if I really stunk at science, I guess I could become a lawyer. But I wanted to be something in medicine. So I spent most of my young age, observing and volunteering and doing all kinds of stuff. And it really came down to one summer that I did a program, and I was exposed to different areas in both medicine and dentistry. And I learned two things. One factor was that the lifestyle of most of the physicians that I knew was not really what I wanted. I wanted to have a family at some point. Number two, I went one day at MD Anderson Cancer Center, and I saw a little 3-year-old girl that was absolutely gorgeous with her mom that looked like a Barbie doll. And this little one was bald and traced for radiation. And I made it around a corner, sat down on the floor, and just cried my eyes out. So that was an experience that told me that I was not really the kind of person that can deal with life and death very well. So I decided to kind of put that one aside. My uncle was a dentist in Chicago. My cousin's a dentist in Chicago. So I decided, hey, let me check this out, right? So in one of those rotations, I had the opportunity to watch the transformation of a young woman. She was probably about 24 years old at that point. She had a lifetime of a very prognatic profile. Her lower jaw was just so long that she was just crippled by her persona. And it was just so sad to me. So I saw these videos of her before. She had stringy hair, no makeup. She would barely look up to even talk to you. And it was painful to watch. For me, it was just painful. I'm very much an empath. And I had the opportunity to watch the oral surgeons, redo her entire face, move the mandible back, expand the maxilla. And I also had the opportunity to see her look herself in the mirror for the first time. And it still makes me cry, to tell you the truth. It was just the most it was the most impacting thing that ever happened to me. So I decided I wanted to be that. I wanted to be the oral maxillofacial surgeon. Well, quickly when I got into dental school, I figured out I can't suture worth beans. I suck at it. And I didn't like blood very much anymore. So I was like, oh, this is not good. So I did go to dental school, but I did not become an oral maxillofacial surgeon. However, I was so interested in transformation that that's what I chose to pursue. So that's how it happened.
So when you came out, were cosmetics really coming up? Were they, or had it really just started?
Yeah, at 30 years ago, if anybody really thinks back, that was alive back then, because there's so many people that are so young. There weren't very many of us that were women, first of all. I mean, to tell you that. I mean, when I went to dental school, when I went to interview for dental school, I had this older Army dentist that was the head of the restorative department doing my interview. And I was 19, granted, so I was young doing this interview. So he looks down at my application, looks up at me and says, "So what are you doing interviewing so early, little girl?" I mean, he literally said that way. Now,
he said the little girl, the actual words?
He did. He said, little girl. And, that wouldn't fly very well now, but that's just kind of gives some idea of where we were in dentistry at that point. And there weren't very many women. So much less were there wasn't an aesthetic program. There was not, any of our courses that really were around aesthetics. I just happened to have, and I don't believe anything really happens by accident. Fred, I think you and I both are kind of in that same, just from being around you, that I believe God puts people on your path, whatever people want to call it, but I call it God. And there was a Dr. Mark King who came to the dental school to teach an elective class. It was an aesthetic class, a bonding class. He happens to be an orthodontist. And I'm so touched that he actually visited me a few weeks ago. And I hadn't seen him in so many years, and he came out to visit to practice, and it was really cool because he's been my mentor. And so I had fallen behind in school. My mom went through cancer. That was a bit rough on the entire family. And then I fell down and I broke my right wrist. And so I fell behind in clinic too. So I was like really, struggling to try to make it through school and finish on time. And I was kind of convinced that I was going to end up having to do an extra year or something. And in comes Dr. Mark King, and he's doing this lecture. And I'm like, well, why not? I'll take this, this class. I'm going to take another year to do this anyway. I'll take an elective. I'm not in a rush. So I'm sitting there and I'm looking at his pictures and his slides of his bonding. And I don't know, it was like this inspiration thing for me. And then in clinic, what he did is that he would bond one tooth and have the student bond another, the contralateral tooth, and then he'd correct us. Well, he did that back and forth, and we did that until I got to it was at the lateral. He made one correction about a line angle. Then we got to the cuspid, and he did one, I did the other one, and he goes, "That's a pretty darn good looking cuspid." After that, the man lit a fire under my foot and made me just move it. And I finished on time and I graduated from my class. So there were no programs. At the end of that year, I was fortunate enough to end up in a program with Michael Miller and Craig Mabrito, two very prominent doctors here. And Michael, I think, as you know, had Reality magazine for ever and ever. It was all kinds of stuff about materials and techniques. So I was his first intern. So I spent a year with Michael and tested materials, did writing for all kinds of articles and all kinds of things that we were doing and testing stuff. And I got thrown into doing my first 20-tooth veneer case the second day I had my license. and it was on a malpractice attorney. So that's how I ended up learning. It was, yeah. And that man is still my patient, and we've only had to redo one. So it's been great. But I learned so much.
Well, you're extremely cautious about getting sued. So you're going to do everything very well on him. So.
Yeah. Well, on all of them. That's the way I treat them all, I promise. So,
You treat them all like they're a malpractice lawyer. That's
you never know.
I'm going to use that as a new marketing term.
There you go. I'm knocking on wood. I've never had that happen. So thank God.
That's in and of itself is remarkable because it just happens. You don't have to do anything wrong.
You don't. You don't.
No.
And 32 years, thank God. I'm knocking on wood. So
that is very impressive. So when did you start to own a practice? When did okay, I got to back up on a couple of things. What school was this?
So I went to University of Texas Dental Branch here in Houston. And
Okay.
it was the old campus. Now it's no longer there, and they've got a whole gorgeous new facility that I visited, and it's magnificent. So I was part of what we knew as the basement bunch because they had us down in a basement because the whole facility was old. But super education. I just, I can't be grateful enough. So it was.
And do you remember what tuition was per year?
Good God. No, but it was a state school for me, so that was good. I mean, my daddy was the only one who worked in our household. And I'm really proud to say that, I mean, most of our life, I don't think he made even $40,000 a year. And my dad started out when he came here and didn't know English yet. He worked at a Zenith factory. And then once he did, he applied at American Airlines. He worked for American Airlines my entire life and before I even was born, and started out with carrying baggage and cleaning airplanes, and then became a ground crew chief. And I mean, out of his 8 children, he's got all of us educated, college educated, except for maybe one. 2 of us are dentists. One of them's, and the girls are it's like we've got 2 dentists, 1 architect, and a CPA who's now a stay-at-home mom because she's got twins. So I'm really proud of that. I don't remember, to tell you the truth, but I have to say that I don't think I came out of that school with more than, I don't know, total of maybe $60,000 in debt compared to what people have now is ridiculous, right? So
$60,000 an hour, it seems like. Yeah.
Yes, so. I agree. I know. I have 2 daughters. So well, now I have 3 with my husband's. And so, yeah, it's like, think about sending your child to Tulane. It's like, wow.
Yeah. I have so many friends right now with multiple children in college and on track to go either to dental school or post grad. And it's a staggering amount of money.
It is. It's crazy. It's crazy. And I mean, my heart goes out to those kids because it's like, wow, how do you do this? We thought it was bad enough then. Yeah.
I mean, they'll be paying off loans for 20 years, but it's a great career. And,
it's worth it.
And I this thing you said about your dad is fascinating because you probably have had years in your practice where you earned more in a year than he earned in his entire working career.
That's right. No, absolutely. For sure. Yeah. And
yeah, is he still alive? Does he no?
No, I lost him almost 8 years ago. Yeah. Wow. And he was man, he was beautiful. He was a super handsome man, charismatic, only about 5'7", but he stood like a giant. So, and my mom is amazing. I mean, my mom is now 84 years old. She now moved into a new house. She's from Lima and she had not gone back to her country for 46 years. And my husband and I decided to take her 3 years ago. So before COVID, and she had not been back in so long. Oh my God, you had to have seen my mother sand surfing on these giant sand dunes in the desert of Ica, Peru. It was amazing. On her belly. She's like, I want to do that too. And I'm like, Mom, you're 81 years old. She goes, so? We took her. She's done that indoor I-fly. She wanted to jump out of an airplane. So just, yeah, lots of energy. All I can tell you. It's like, and me. You've known me for a long time. I'm kind of that bouncy trouncy.
No, I can see where you're getting it. No, it's all making perfect sense. Yes. But that, I think that's part of why people accept treatment from you is that you exude positivity and a powerful happiness that I think that they go, I want some of that somehow. Maybe she'll put it into my teeth. So when did you decide to own? When did that first happen?
Well, that happened. I really was not like, oh my God, I went to dental school, because I wanted to actually have my own practice, because anyone who knows me, and that's why we're going to talk about the ins and outs and the struggles. I mean, I struggled with business, the numbers part and whatnot. So I started out, I really wanted to just partner with somebody. So I ended up working for this one country dentist, this good old boy dentist, and his office was like a country museum, totally not my style. I needed to get him updated. I wanted to get new technology in there and whatnot and so forth. And he kept promising he was going to sell me the business, right? So that I was thinking, okay, I'll kick him out and get somebody new in here, bring my sister in, whatever. And man, he just drug his feet so long that finally I was supposed to go and open an office with another female friend of mine who then ended up teaching at the dental school. She decided to do that instead. So I was kind of stuck. I was like, okay, now what do I do? So I needed some temporary work. And I had these two friends. One of them was my classmate. One was a year younger. But these two guys are like the golden guys. Anything they touched turned to gold. And so they had, and I say had because now they've sold it, a huge thing they sold for. But they had put together Medicaid offices. But these Medicaid offices were like, they really cared about taking great care of the kids and giving them good treatment and not over treating and really doing all the right things, right? So I kind of worked for them temporarily. And when they started to ask me like, okay, so what, Amanda, I know you're in the cosmetics. What do you charge for a crown? And when I told them at that point that I was charging $1,000 for a crown, they were like, what? Okay. So what if we like make this beautiful office like in the Galleria where we could be like totally proud to send all of our friends and our family and everybody like that. And then you teach other doctors to do what you do. And then we'll make more franchises and you can be a partner. I said, okay, sounds like a good idea. So they first built Cosmetic Dentist of Houston in my first location. And it was beautiful. And I'm talking like they threw everything in, all this stuff that a lot of those things in your books about the marketing, all those, and these guys, they were doing it right. And so we started growing it. However, what they figured out very quickly was that my bushel of oranges was absolutely not the same as their many bushels of apples as far as return on investment for them, because when you're having to pay the kind of materials and the kind of lab fees and pay me properly and so on and so forth, their profit margins were not what they wanted. So essentially they came to me and said, hey, we've decided that we don't want to do this anymore. So we're either going to close it or you can buy it for this amount. And I went, I'll buy it. So I didn't know what the hell I was doing. Thank goodness I was married to my first husband and he had some business acumen. And so he helped with that until then we didn't work out. Off we went. So then I was kind of stuck with it. Hence a lot of the roller coastery things that went on. But we'll talk about that when you're ready. So that's how that happened.
Yeah. And so you're off and running, so to speak. Now you're an owner, you're a solo owner, essentially. But you've built up somewhat of a patient base at this point, right? And certainly somewhat of a reputation. Now, are there other instructors out there that you encountered as you upped your skills? Because cosmetics is obviously something you keep up on.
Oh my gosh! So everything from Frank Spears to Pete Dawson for occlusion to, some studies at LVI. I've done so many different things. And a lot of it, I'm going to be honest on this. I really feel that I was really more of an artist in my being, I think, than really the scientist. But I became the scientist because that's what my parents expected. And I'm so grateful for that. yet within my science, I found a way to be able to practice my art. And not that I've ever studied art, and I've dabbled a little bit in painting. I really haven't dabbled yet in sculpting, but I look forward to that. Yet, it's like one of those things where, I remember the first time I was I'm about to like date myself here, but when, I started dental school, one of the professors handed us all a block of wax and said, here, I want you to carve this, and there's a molar and you needed to carve this thing to look like that. And I found it fascinating and exciting, and it certainly looked like the darn model, better than most people's. So when it came to things like pharmacology or, physics or anything like that, oh my God, I sucked. I'm serious. It's not fun. And I did everything I had to do to be able to get into dental school. But I knew that it was really the art form. And to tell you the truth, Fred, it's really more about the people. I love people. I think I would shrivel up and die if I couldn't be around people. It's just who I am. And yeah, every personality survey or test that I ever take is like, that's who I am. It always comes up like 98% of my values. I've never been somebody that values money that much, yet I've also learned about business and how it's necessary to make money. It's necessary to have money to help other people, to do other things, to be able to give away dentistry when I feel like it, to give jobs to all of my team. So I know that our friend Bernie Stoltz always would tell me, Amanda, you've got to fall in love with what you hate. So I've grown to love it. I've grown to love it. Yet my passion has always been people and transformation. So that's what my practice has always been about. And it's not like with the name like Cosmetic Dentist of Houston, it's been kind of a curse and a blessing at the same time, because a lot of people have thought that all we do is cosmetics. Well, no, you can't have something beautiful unless it's healthy and it has great function. So my list would be endless, to tell you honestly, because I've learned so much from everyone. And I have to say that probably the people that have helped me the most with my practice and what I've done, not clinically, didactically, but have turned me into a better human being, the human being that I know I wanted to be, and a practice that is humming and doing amazingly well, even through pandemics and whatever, or hurricanes and stuff. Those are my coaches. Fortune has helped me beyond belief. And I'm not trying to do a commercial, but I will never practice without Fortune again, because I did early on and my practice was humming and going. And at that point, to be right up there in a $2 million, level with just my sister and I and one hygienist, we were kicking ass. But when my world all kind of tumbled down after the divorce, then it was like I couldn't afford the coaches anymore. And then things spiraled, and now I've rebuilt. So life is better. Thank goodness. Did I answer that question, or did I go around a bunny?
Yeah,
because I can do that.
No, it's anybody who is at your skill level has had all sorts of, is a CE addict basically. But there's these moments, but also you circling back to the things that you had to force yourself to become good at in order to run a business. And you've become very effective at producing a good income while doing your artistry. And there's plenty of dentists out there who are phenomenal clinicians who are hanging by their fingernails. They're just like, they're not sure if they're going to meet payroll on certain months. And that's,
I've been there.
Yeah.
I've been there lots of times.
Yeah. And so when you talk about coaching, it's the same. When I hear people, it's two things that people do. They get in financial trouble, they fire their coach, and they stop advertising. It's like they clamp off the two main arteries and try to see if they can keep functioning.
Yeah, no, it can't. Right. It makes all the sense in the world to me now. And I'm just so grateful that, again, like I said, God puts people in your path. And it was at a point where I was like, I think it was the 2008, all of the crash of the markets and all that stuff. Well, even in Texas, where there's so much money, I mean, people were holding on to it. We had all kinds of hurricanes and storms, and I'd have one guy in here talking about how he couldn't find 10 of his wells. And I mean, all this junk was happening, right? So, I mean, and it's true. I mean, it's crazy to me how people show up with money here, but that happens. And I mean, I went so far that, at one time my accountant told me I should just go declare bankruptcy. And I said, I will not. And I refused to let any of my people go. And so what I did was that in order to keep these doors open and pay everybody, I just wouldn't be able to pay myself. So in order to keep my kids fed and still in their school and their private, I worked like 6 days a week. I worked my 4 full days here. And then the 2 days I went over to that Medicaid office and I worked my butt off. I mean, I would see, here I can see 1 patient a day or at the most 5. There, I would see 45 patients. And, that almost kills you.
It's a different ratio right there.
It is. So yeah. I know what it's like to hang there. And I'm so grateful that at that lowest moment, I actually, I had to let my office manager go because there were some shenanigans going on there with my finances. I've had all that happen too, so I can tell that story. And I happen to be sitting.
You've avoided malpractice, but you hit all the other speed bumps.
I'm telling you, I've hit malpractice, but I mean, I've avoided that one, thank God. But I happened to be in the audience at this meeting, and I swear to you, I was so upset. But I had this, and I committed to go, and I show up at this meeting. I don't even remember at that point what meeting I was going to, and I'm sitting there like in the second row. And who do you think walks into the room but Bernie Stoltz? And he looks into the audience. He goes, Amanda Canto, is that you? Oh my God. So my life changed. And I mean, that's why, I mean, there's so many, I mean, I've done Pack Live. I mean, so there's so many people that I could thank and say that they were just huge. But I think the hugest impact has been through my coaches.
Yeah, well, Bernie's the CEO of Fortune, and he's also, that's a perfect example of like, he knew that you had stopped using Fortune, and he's like, it was like nothing changed except you weren't technically a client anymore. You were still, the relationship was still there, and their relationship is with their clients become lifelong for that reason too. There's an intimacy that goes on. Absolutely. When you've got somebody that understands your practice and you can talk to and say like, where am I messing up here? What am I not seeing? Right. And they see it. They're looking, they point right to it and you go, oh, okay.
Exactly. Yeah. And somebody who will pick you up and give you a hug and say, oh my God, I haven't seen you since we did that, all out thing with Tony Robbins. And it's like, okay, so what's going on with you? And it's like, let's get you back in with us and whatnot and so forth. And how blessed am I to have Renee Schubert as my coach? She's not even a coach here in Texas, but that's who it is. So I think that the kudos go there a lot for me.
So let's talk about the divorce. Let's talk about things blowing apart.
So,
if you want to, obviously.
No. You know what? It was kind of a double divorce. It was sad. It was a really sad time. And, I suppose we just have to go through things so that we learn. And, I really believe that there are just, certain characteristics about people that maybe don't blend, and opposites attract. But if they're too opposite, eventually they start to repel. You may have had some of those experiences. And, unfortunately, I'm going to be honest, I think that there was just, it's hard. It takes a very strong and secure and self-assured man to be with a woman that is successful and is outgoing and is producing well and maybe producing more than you, it takes somebody pretty special. right? And I think that's what drove us apart. And eventually it was done, right? And we were done. But I'm so grateful because I have my two daughters. I'm also grateful because, he helped me get it started. And right about that, and, my sister was practicing with me. We split up too, so that was not fun. And all of it happened at the same time, right? So that was rough, because I don't know if you know, but my family, we're a very close family. Sometimes I think I've learned maybe, too interdependent or codependent or whatever the phrase was. And I've gone through a lot of therapy to fix all those kind of things. And I'm a better person for all of it, but it was really, really rough. I had an entire team leave on me. My sister broke up with me. She ended up going somewhere else, and we didn't speak to each other for a while. And that was the most painful thing. That was more painful than the divorce. And thank God, we're such great friends now, and we help each other out. She's got an amazing practice here across town in River Oaks, and she's an amazing cosmetic dentist. She's been my dentist, and I love her dearly. And we've made up and kissed and made up. And the ex-husband, I've been a good parent with him until my daughters are now old enough and they make their own decisions about things. So I'm happy now and then I found, the man of my dreams finally. I waited 16 years though.
Yeah, there was an interval there.
Yeah, there's an interval. Exactly. And, through those times, it's like, sometimes you love who you are, sometimes you don't love who you are. And it all, in the end, makes you, who you're meant to be, I believe. So I don't think anything happens by accident. And, I think you and I met at a point where, life wasn't so great. And, you kind of lose.
Yeah, I feel like you had just come back to fortune, but you were digging yourself out.
Yeah. I had somebody embezzle a bunch of money, ruin my credit. I'm really super proud of where I am now, but, because it's like, I don't use credit cards. I don't have to do that. And what's wonderful is that, I had somebody really mess me up and took my credit from a really great score to like really poor, like in the 400 layer, there. And I'm back up at that top of the scale again. And I love that. And I'm proud of it because I've had to dig my way out.
Right. And, yeah. Because a lot of people, like you said, if your accountant tells you to go bankrupt, that usually means you should be going bankrupt. It means it's the end of the line. Right?
Yeah. There were times where I would be sitting at dinner with my kids and there were bill collectors calling. That's how bad it got. And, I'm happy that my family, my parents, really instilled in us this desire to be strong. And I don't think that God gives you more than you can handle. And I truly believe that if it hadn't been for my final, what will I say? Just giving it up, trying not to control it myself, because I've always been a little bit of a control freak. I think I've given that up. And I take the coaching from wherever it's coming. You know what I mean?
Yeah.
No, I think having a beginner's mind or a learning mind and not thinking that we know it all. I think my ego was in a way for a long time. And I don't do things for that reason anymore. So I think that's what makes me happy now.
Yeah, well, your ego takes enough of a beating where you go like, I'm not, I need some humility.
There's nothing left.
Right. Your ego leaves because it's like, I don't need to be associated with you. You seem to mess everything up. So
that's right. That's right.
But you know what? I think, of course, it's what doesn't kill you makes you stronger. But it's also, I think there's some people that have had a pretty easy path, but almost everybody I know who's been in business long enough, there's been some serious moments. I certainly have had several moments, usually that were associated with the economy, but I managed to tack a couple of divorces onto my life as well. And you say like, okay, once you find your way out of that, the first or the second time you go, all right, so I can go all the way down and find my way back. And so you kind of relax, don't you? You go like, I know there'll be a way out. So if somebody can try to take me down, but I will find my way back to this level. Now, one of the you did work your way back, but your husband, Carl, was he instrumental in finding your way back?
I'm going to say that, yes. I mean, and I have to back up a little bit on, I met the man of my dreams, because it's so funny that, over time, that man of my dreams just kind of kept morphing. And it just ended up one day when I was like, all right, I'm really okay. I'm happy finally in my own skin. I'm happy being on my own. I mean, it was 16 years that I had not, I dated, but at some point I was like, it's all good. I'm having fun with my girlfriends, my daughters, my family, and I was cool. And I finally just gave that up and said, hey, you know what, Lord, you've got the right one for me. He must be amazing, because I'm sure that's what you want for your children, because that's what I want for my children. And if you do have them, then I'm open to it, and just bring them to me. I'm going to stop looking. And he walks, right? Carl was, an executive, an oil and gas executive. Chief of staff of engineering at Apache Oil. He ran this massive operation in Egypt and lived in Egypt. He's worked for all kinds of different oil companies. He's owned part of an oil company. And so when we started dating, or once we were dating and had already fallen for each other, he comes one night and tells me that he'd been offered this vice presidency in Argentina. And I said, oh, okay. Well, almost kind of it was nice knowing you, because my daughter was still in high school. My older one was already gone to college, but my younger one was and I wasn't going to do that. And on top of it, I always think about, oh my God, what would I do to my patients and my team? And I just can't pick up and leave like that. So I told him that I didn't think I could do long distance. And, because I'd kind of done that some while I was single, and I just didn't really want to do that. I really wanted someone here. So lo and behold, he turns it down. And I'm like, I can't believe you did that. So I knew that at some point we would end up together. I will say that when we got married, I did not know that, and when we first were dating, he'd come to all my Fortune meetings. With my Platinum Circle meetings, he'd come. And he wouldn't go play golf. He'd sit in the meetings, right? And he was just my boyfriend at that point. So I knew something serious was coming of it. Once he retired from oil and gas, once we got married and he came on board, he thought he was going to get to play golf. But then instead he got thrown into the dental business. And he had zero knowledge. As a matter of fact, he used to be terrified of going to the dentist until he met me. And the business grew 100% in the first 3 years. And even through COVID, we grew even through COVID being closed for 10 and a half weeks, I think we still grew 6%. We grew, and we're on track for even 20% higher. So the fact that he's so great at business, and I finally get to do what I love. So he's taken on all of the business parts. Like right now, we're designing a whole new office on another floor in this building, and it's going to be twice the size as this one. And thank God that he's on I would never be able to do that. I never thought I would ever build out another office. And only because he's on right there. First of all, we have the finances to be able to handle things. He's the one who manages all of the construction people and the drawings and meetings and calls, and he's investing in other things. So I get to do what I love, which is inspiring my team, inspiring my patients, enjoying them, getting to do beautiful dentistry. Yet, we are a partnership. So I do sit down and look at P&Ls with him. We just spent 3 hours going over plans for the office. So we're just better together. That's really what it is. And that's kind of our motto, is that we're better together. So it's been amazing.
Bernie's advice is you got to learn to love what you hate, or you got to find somebody who loves what you hate.
Exactly.
And
so I don't love business, but I love him and I trust him. So it's great.
Yeah. No, and obviously it's worked great. And that is, we see that certainly a lot in Fortune as well. We see the husband and wife team where either the wife comes from a business background or the husband comes from a business background, and the dentist gets to be the dentist and not have to be fully engaged, because it's just a tremendous amount of work to run a dental business. And really difficult to do alone. And it's why you can really go so far with a partner, just like with a great team, like, 2 or 3 dentists all working together and building a multi-specialty practice or whatever. You go a lot further because people are playing off their strengths and weaknesses. Everybody else does it in business, right? We create a business and we go like, well, I'm no good at this. Like me, I always needed a really strong CFO because I didn't want to look at the numbers, right? So I needed a guy to go, slow down, right? You think there's a lot of money in the bank, but it's the first is coming up in like 4 days, right? And we got to pay $3 million in media, right? So
totally get that one. Yeah.
Finding those complementary things. So how do you, how would you describe your culture in your practice? Because does it hold your team together? Are they on board with the Amanda plan?
Well, I learned something very powerful at one of our Platinum Circle meetings. Not one, maybe it was multiples that crammed it into my head. And it made total sense because, most of the time you hear dentists complaining about their team and, this one's not doing this. And oh my God, I have to tell them a million times and they're still not doing this or whatever. And what I learned and what made a big difference for me was that every time we complain about something that's not going right, we have to look here. Who's leading this bunch, right? And I literally have to say that I could not have the reputation that we have. I could not have the level of production. I could not have the profitability. I could not have the enjoyment of the practice without those people that we have as our team now. And I feel like we have a dream team. Really. And all it's been is really looking for people that are passionate about being here for a reason, right? When they don't seem, so when you ask about my culture, Renee always says that culture eats strategy for breakfast. That's what Renee says to us. And so I've learned that one, and it's stuck in my head, is that culture eats strategy for breakfast. We could have the best systems. We can have everything that is drawn out. We could have scripts. And that just doesn't work. What works is getting people to remember why they're here. Why? And I am that person who is like, so Carl is very complimentary because he's not just a business person. He's got a real, even for an engineer that he is, he's got a great personality. So we are very good about balancing each other. And I know that just by growing into a better leader, I have attracted some amazing, amazing human beings. And I'm just so proud of who I have and what they do in this practice, because we wouldn't be able to do it without them. So the culture that we have is, and you said, how would I describe it? First, I'm going to describe it as, a culture of fun, where we're happy. It's also a culture of integrity, a culture of accountability. We don't have team members that last on our team that make a mistake and cover it up. I always tell them, no one's going to get fired for making a mistake. You will get fired if you cover it up. You will get fired if you try to blame somebody else. You will get fired if you don't learn from those mistakes, because that's one thing that I can say, that through all of my ups and downs in my life, is that, we can continue to make the same damn mistake over and over and over again. If we don't look and say, hey, what's the common denominator here in these problems? and you don't choose to change things, then it's your own problem. You're creating a terrible world. And what I've learned is that it's a lot more fun to build your life by design. We heard so much of that at Fortune 50. When Lisa DeMaio was saying, you've got to, what is that dream? What does that picture look like? What are you going to visualize so that you're doing that? It works. It works. So we have a culture of people that love people. We have a culture of people that want to be successful, obviously. So, they bonus extremely well. We grab bag. It's exciting. I mean, the other day, I think we had 72 pulls from the grab bag. They emptied the entire thing. And it's so much fun to see them, hey, at 50. So we do things that are fun. We play together, and we make people happy. That's all, and so it's very rare that we get a patient that comes in here and has a bad experience, because that's not acceptable. But that's had to come from me and from Carl becoming better at the job of drawing the right people, because if it doesn't work, Bernie's the same one, the first one that says it, every time he says it sometimes from, I think it was a Dalio book, for a public a hanging or something, you got to figure it out, go somewhere else if it's not working. But I'm thrilled about my team. And we have a fabulous culture. And that's why even after 32 years of practice, we're building out this huge new thing, pulling out a lot of money, pulling out the stops. Hopefully it's going to be beautiful. I hope you'll come see it. Even after 32 years, we're happy to do that because it's exciting and it keeps growing and it keeps changing. So keeping up is important.
Now, is there any technology that was sort of transformational for you along the way?
Yes. So it's so funny. So I won't say that CEREC was transformational for me. However, I want to thank you, Fred, because you actually were the.
Oh, I didn't know I was queuing my own credits here.
I know. No. But I don't even know if you remember the conversation in Chicago. This was Chicago many years later when we were, sitting in the bar. You're on the floor and we're talking about different things, and that was when you were doing things with CEREC, Yeah. And I was like, I've done that. I've had the machine. It sat in the corner. Crown's broke. Blah blah blah. I don't want to do it again. But man, you filled Carl's ear in with that much. And before we had left Chicago, he'd already signed me up for a course in Scottsdale with the Spear campus. And I went there and it was like, whoa, these things are doing this. This is pretty cool. So I would say that it wasn't that CEREC has transformed my life, because, I still do more, giant cases that I'm not doing that. But it was the thing that revolutionized the thought of we need a digital, not one, we have multiple. Then we need digital scanners, right? So that was like, I would have never thought about that. I was like, why spend that much money when now it's like, they're fighting over the iTeros. We already are going to need more, right? Invisalign has been fantastic for me now. I had certified so many years ago, but I've always been one of those dentists that if I'm not going to do the best job for somebody, then I'm going to send them where they need to go. That's just me. That's always been me. So, I've made this practice hum like this without doing endos, without doing surgery, without doing, any partials, dentures. No, and lots of people have called me a diva, and I get it. But that I really thought to myself, why would I do that? And so what I do is I partner up with the people that are really great, and they do their part, I do my part, and it comes out fantastic. And then we grow in reputation and more people come. And it's been great that way. I now have an associate that's bringing on some surgical skills. He does endo. But as far as Invisalign happened for me, I think that was something that revolutionized the way that I practice, because now I'm really looking at, okay, why would I prep 40 teeth unless they're ground down to nothing? 40 teeth, $40,000, but 20 teeth or whatever. Why would I do that when, we can extrude this, intrude that. Now we've made it a much simpler thing and we're not cutting down people's teeth, right? Because I've been that product of that wave where there was no option but braces, or not a good option. Invisalign that really took like 3 years to do. Nobody wanted to do that. But now everything has really, so now I'm totally open to different techniques. So now, as a matter of fact, I'm leaving July to go do the DSD, the Digital Smile Design Residency too in Seville. So we're adopting all of that. We're building out a DSD room in our practice so that we can do all the emotional, things that I've already that I did in an analog way. Now we're starting to do it all digital. Does that answer that?
Yeah. So you clicked into the digital transformation and stayed ahead of the wave because it just keeps coming in every possible direction.
It does. So it does. And like for instance, those iTeros, I'm like so excited and so proud that I have, we used Shannon Richkowski of, Hygiene Mastery, and she's trained our hygienists, but our hygienists are the kind that are like, yes, I want to do a scan so I can show this patient next year, any changes that have gone on. I show them the simulation of their teeth. So and I love that. I love to be able to say to my patients, I can show you what I see. You can see what I see. So you don't have to take my word for it. I like to build trust before we get to a conversation where trust is going to be required. I build it before it happens. So I'm always building relationship and rapport. And that's what I think I do the best, is building relationship and rapport. And, so we utilize all of that technology, yet we're not letting go of, I see so many things, so many businesses and so many industries and parts even of our profession that are going to the digital age, but they're losing communication. There's such a lack of human communication and human contact and rapport. And that's the part that I refuse to lose. So I think I'm going to go back to the definition of my culture. It is about getting people that are on board to wanting to become master communicators so that we can positively impact the patients. It's not just about transforming a smile. What's more important to me now is we transform their health. We catch, airway issues. We catch periodontal disease. We catch oral cancers. We get them to not be the white knuckle patients anymore. And they now come in and they love coming here and they fall asleep in a chair. They love coming and they send people. And those are the people that would sweat standing at my door thinking about walking into a dentist's office. So that's what I really, it's even like when I look at my bonding, I love to bond. And I know it's becoming kind of a lost art, because people are going so digital. But there's such beauty in some of those handmade things. And there's more beauty when it's all this heartfelt thing. When you're putting your heart into something at that level, it's you fall in love with it. And you keep wanting to do it. So that's that.
Well, I think that sums you up well and sums up the real success that you can have in dentistry and the dentistry that you can do for a lifetime that is satisfying. So I'm going to end on that note because I think it's so fabulous and so inspiring to people to know what can be and what a great profession this is if you choose to make it that. If you choose to embrace what it can be,
it is.
And it is about the relationships. And I'm so glad to be seeing you and seeing your great success and have seen your journey. And I look forward to seeing what's next, what you and Carl create as a super team. And so thank you for your time. This will inspire people and give them insight and
thank you for being my friend. I thank you. I call you. I hope you know that that's a true feeling for me. Thank you for being a friend. I appreciate it.
Thank you. I appreciate that. And I appreciate your friendship as well, Amanda.
Right.
So everyone, the amazing Dr. Amanda Canto, if you like the podcast, share it, subscribe to it, do all that stuff, tell your friends about it, but mostly watch it and learn from it, and keep on being remarkable.